We'll call the meeting to order, please. First item on the agenda are the minutes from our last meeting, January 17th, when I was late, or which I was late. Mr. Blackwell ran the meeting, thank goodness. So if you haven't looked at them, you will, and then I'll take a motion to approve them.
Motion for approval.
Second.
Okay. Any discussion, comments on the minutes? All in favor say aye.
Aye.
Okay, that's unanimous. Thank you very much. Dick, did you go to financials, please, sir?
That is, everybody has a packet. Total checking and savings, $2,820,051.05. Taxes receivable, $76,788.94. Prepaid insurance, $2,837.57. Total fixed assets, $6,479,835.40. Cash and medical library fund of $15,809.63. Surplus certificate of $38,984.52. Total assets, $9,433,307.11. Reserve for uncollected taxes of $76,788.94. Total equity, $9,357,518.17. Total liabilities and equity, $9,434,307.11. Deposit detail. A deposit from ETMC of $27,709.17. That is the regular monthly payments for the Surgery Center and the Women's Center, the quarterly payment of $17,500, and the CPI quarterly payment of $3,055.64. Taxes received for the month of January, $33,279.58. Actually, those were received for December, but we received it in January. This is from ETMC, a deposit of $233,722.98. That is one of those UPL sweeps, and you'll see the debit coming out in the checks. CD interest, $1,642.81. $900 rent on the EMS building, and interest on the checking of $66.63. Check detail, there's the UPL sweep, $233,722.98. Direct TV of $106.23, Windstream $103.97, my fee of $800. Irma Chavez, there are two. We failed to pay her in December, so there's two checks, $280 each month. Ray Morrison, $76.73 for reimbursement for light bulbs, and Critter Getters, that is for pest control at the residential house, $86.60. Profit and loss year to date. For the month of January, the net income was $61,417.48. Income for the year to date was $243,595.74. All the regular payments were received. Next page, profit and loss versus the budget. Year to date, actual income was $243,595.74. We had budgeted net income in excess of expenses of $173,613.44. So we're ahead of budget by $69,982.30. All items look basically normal. Any questions? Then cash and investment summary. The CDs stay the same. They're all yielding 1.25%. Checking account, which has $727,000 in it, is yielding 0.1%. So the next maturity date is April 21st, 2020. The only other questions I would have is that we have received another bill from Scott and Strong, and I need the direction of the board as to paying that bill. There are also two checks that we didn't sign from the month before. So, I'm not sure what.
Okay, well, I'll get that rectified. Any comments on the budget? Anybody have questions?
Make a motion for approval of the financial statements so given by Mr. Murphy.
Second.
Second.
No questions? In favor? Aye. Unanimous, thank you. Okay, Dick, who's going to do the discussion on the RN program? Is that, you got it? Okay. Your turn.
So at our last meeting, we were approached, part of the transitional program, and I may get this part of this wrong, but it's explained to me, is that students that are LVNs and/or trying to get in an RN program have to take an anatomy and physiology class. And so they'd like to offer that at the Angela College campus over on the South Building. And they asked us would we help get that going, since there's a substantial investment in the beginning to get the program because of anatomical section devices and equipment. We presented this, maybe you got here last meeting, and I explained this to everybody, but I'm going to read with you the presentation. It involves a quite lengthy list of equipment, which I can pass around, but it's a lot of animal cell models, sheep size, sheep's hearts, just various things you'd use in a scientific laboratory for dissection, both permanent and temporary. There was a couple of questions that you had asked, the group had asked, and was it these classes open to the public, or are they just restricted to pre-nursing or nursing students? And the answers are open to anybody who wants to take it, although 80 to 85% of them are expected to be nurses. And the answer was just a comprehensive list, and the response was that it was. There was two parts of this list. One is all the equipment for this class, but there's a second class going on out there that, as I've investigated a little bit more, that they offer about 5 times a semester. There's a CPR class that all the students have to have that are in nursing, phlebotomy students, first responders. Basically, anybody needs CPR class has to take this class to move along. And so the equipment for that is also a separate bid, and we can address it differently. One bid is specifically the anatomical section equipment and those equipment for the anatomy and physiology class. And the other bid is for the CPR stuff, all the mannequins and things that they need for basic life support, both children and adult. The total amounts of those were for the class $26,000, and for the mannequins $1858.80. The mannequins are a more exact amount because that's a fresh bid. The other one was based upon several years ago, and they thought it would probably be more than that, but they would take that. So they've asked us to consider that to further the education of both the first responders, the people in the phlebotomy classes, as well as the pre-nursing and nursing students. Are there questions about this presentation, about what they're requesting of us?
I just want to ask a question. Did you say that there's an ongoing course at this time that they're already offering some of those courses to first responder? Or they have no courses out there whatsoever on any of this? And this is actually 2 courses that we're actually looking at.
One of them is the anatomy and physiology course,
Right.
which is necessary for the nurses that are going
The
to
transition,
transition from the LVN to RN program. And the other one is just this CPR class. Okay?
It's just
The ANP
CPR only, that's just the...
Well, there's some fancy name for it. Let me see.
Do they offer EMT training at Angelina? I know they do at the main campus.
You can answer. I can't answer that question.
Okay.
I can tell you that virtually everybody in the world that's involved in healthcare has to take CPR training at some point.
After 2 years.
So this is 2 requests. The CPR class is offered 5 times a semester for 10 students. So 50 students a time, 50 students a semester can take that. And this is for 10 students. It's 10 children, childs, and 10 adult mannequins. So that would be supplying that. The AMP thing is a separate class.
That's basic.
So do you understand what they're asking? And we have the options of doing nothing, supporting one or the other or both.
Now, which number went with, which I missed that? 1858.80, is that for the CPR?
That's for the CPR equipment, and the 26,000 for the A&P class. You know, The board has, over the years, made a substantial effort to enhance nursing education with the building of this building, and we felt like it was good for the health of our community, and that's how we justify doing this as hospital district, because if you don't have good nurses, you're not going to provide good health care. So the step-up program to allow LVNs to go to RNs, I think is crucial. One of the problems a lot of our nurses are married and can't just run away to a class, or they have children elsewhere. So I think this is a benefit to our community. Yes, sir.
And the funding also goes toward not just for the mannequins and the CPR mannequins and the other anatomical bids, but also for the enrollment of 10 students per class.
The total cost includes adult and infant mannequins for 10 students, instructor course manual, and DVDs, AED trainers, resuscitator mask, and there's a list of.
I think the
I
students.
guess what I'm saying, this is a continuing class, and there's going to be one semester, and another semester, and another semester.
Well,
But the initial cost up front will be just $26,000, which is mainly to cover the majority of that.
actually, they offer 5 classes a semester. They don't always fill.
You're talking.
You're talking about the anatomy and physiology? You're talking
Yes.
about- Oh, that's, I'm not sure how often that would be offered, I guess, once a year.
We would be sponsoring 10 slots out of the hospital.
No,
CPR,
CPR.
okay, I'm sorry.
CPR is 10 slots. I don't know how many is in the.
You know how many, okay, I'm sorry.
I think what he was asking maybe was, is the 26,000, is that a recurring cost?
No, that's to buy the equipment to get the lab going.
Okay.
They would handle any replacement. I'm sure some of the stuff has to,
Yeah,
where it's out
sure,
replaced, they
yeah,
can
sure,
handle
sure.
that. That's just an amount that they couldn't come up with initially.
Would we be assured that the equipment for which we paid would remain at the facility in Rocket Island?
I can tell them to do that. I personally am not going to drive out and count the
Yeah,
mannequins.
but I just, mean, you know, it'd be kind of goofy if we paid that money and then they picked it all up and took it up.
Right.
Well,
I mean, I'm just-
we've dealt with Larry Phillips. He's the president of the university over there for a long time, and he's been very forthright with us, and he's been very good about supporting our programs. And he would be glad to come speak to us. I just didn't feel like it was necessary. I mean,
No, I don't think it is either.
also,
Do they have instructors?
with our course, they've told me they have. I can't, and some of this is a little leap of faith anytime you support an educational activity. And if you all don't think it's within the purview of what we do, I'm okay with that. I'm not emotionally involved with this. I just want to support the education of nurses if you can. If you guys think it is, then I, so.
Yeah.
We've not, before in the past, we supported physicians and supporting that, and I think we should support any sort of healthcare provider in the community that makes it better here.
Can you pass the bid down here? Just,
Okay, there's 2 sets of bids. I'll lay them across like this so you can see that they're separate, okay?
Now, so in the past, when we've made supporting motions to support these physically to do this, we looked at the bids and we've given we've never given a specific dollar amount. That just a ceiling and said not to exceed so much and put it in play with that. Would that be an appropriate motion at this time, if we decide to support this, to give a dollar amount? I don't know, how much stuff they did, tell me what you think. This is specific.
right, and then I don't know what this, I don't see that that's on there. There's a separate one for 339.
That's actually part of the other, if you look at some of the next page.
It's-
It's 329. See it? See the other page, at the very bottom?
No.
Yeah, that's not.
It's $10 off.
It doesn't
No
have
shipping
the,
delivery.
shipping delivery.
Do you
Okay.
see it?
I got it.
Okay.
So that's what it is.
This was done in December.
And we're not paying for the professor in this case, Angela College would be doing that, is that correct? This
It
is
looks
just
like
a-
this is equipment and supplies.
Just equipment supplies.
this cost. Did they indicate that they may not do this if they don't get something done?
Pretty rough to get that amount of capital together. That was pretty critical for that. And Dr. Phillips is very good about this. He says if we can't do it this year, we'll try again next year. I'd like to get this done so we get it in place for the summer and start for the fall semester. And we can support a lesser amount, but unfortunately, that's kind of what it takes to get the college going. If you guys feel like that's a lot, what do you guys think it's approved?
Does he need to know this month?
Well, we've been talking about this for several months. We didn't meet in December, and then we couldn't, he didn't have the bid in time. It's been on 3 or 4 months. Maybe if you think it would be better for us to wait, I'm sure he'll accept that. On the
Well,
other
the only
hand,
reason I'd say wait would be maybe to, I mean, this is a lot of money, but I think it should be done myself, but it's not my money. And if we put it off until the next meeting, that would give public comments next meeting, and we can make a vote then. I mean, would that,
I think it's appropriate. I'm
No, no,
okay with
I mean,
anything. I just think if you think it's going to change one way or the other, we should take all the comment you want. We did talk about this last meeting.
okay, well, I missed that, I'm sorry. Did we talk about numbers last week?
No, not for the CPR mannequins, but for the $26,000 for the equipment for the class. We brought that up. Since
Okay.
we did last thing, that's why we did vote it last
Okay.
month.
I'll stand corrected. Well, what's y'all's pleasure?
I'd support the motion that we approve the $26,000 for discussion purposes, to approve the $26,000 for the A&P course, and also we're taking 2 at a time, 2 motions at a time. What's your pleasure?
Let's do the AP.
Okay, so that's my motion.
All right, we have a motion for the, to fund the $26,000 for the anatomy and physiology equipment and lab. But a second.
I second it.
All right, okay, now, discussion.
I'm just looking at the bid and just wanted to clarify that the 26,000 is made up of about 11,000 for the muscle model, a little over 3,000 for microscopes, and then 10,000 for supplies. And some of those supplies, various alcohol swabs, a lot of things that probably would need to be, so I just wanted to kind of point that out. I have absolutely no problem with the and I know a lot of the supplies would not be replaceable items. Like I said, I wanted to clarify that.
Deborah, I asked him specifically about that. I said, some of these things are going to need to be replaced. He says they will keep it up once it's
I think this is the start. Any more discussion? Anatomy and physiology startup cost for Angelina College to establish a laboratory with all the supplies necessary to have classes there. Okay, all in favor, please raise your hand. It's unanimous. Thank you very much. Okay, the CPR class. I can speak for myself. My staff, we get somebody to come to our office every year, every 2 years, every 2 years now, and get everybody in the office CPR. I have to take it to renew my license, but I'd rather the people that work for me know how to do it, they know how to do it. Because if I,
Well, it's your age.
you know, yeah, my age, yeah. So I want to be sure that somebody in that office can revive me. But anyway, we do this, and I'm sure every office in town, George, y'all have to do it. You know how to do it.
They don't put the dogs on.
But anyway, I would think that all the medical office, do y'all have to do that one, every 2 years? Do you do your staff too?
Yeah, we do our staff, if something come in, it's like, everything, that's something.
And I think the, Ray, to answer your question, I think that this would not include any tuition. The tuition would be paid by the people who take the course. This would just be for supplies for the course. Okay. In fact, I would encourage you to maybe to advertise in the paper so that they could really grow. Some town, I can't remember where it was, where everybody in town had come, some small town in East Texas or somewhere. Okay, so I need a motion on the CPR 1858, and then we can discuss it some more. Carol?
And I'll second.
Deborah? Okay, any more comments, any encouragement or discouragement? All in favor, raise your hand, please. That's unanimous, thank you very much. Okay. Mr. Butler, you're up.
Yes, sir. I did want to mention that current news for this board is there's some changes in the rural UPL program. I know Dr. Stovall knows a lot about that right now, and I think you're going to see Byron, Hale, and Tyler on Thursday concerning that. But wanted to just segue about UPL and Medicaid. Medicaid is a drastic change. Obviously, we've seen some reimbursement cuts of Medicaid. The changes for this public, just rural UPL is another issue. Those are the funds that we have. Basically, the way that works is about $2.8 billion in the state of Texas. That is Texas government funds for Medicaid. And they send those back to the hospital for the unused portion of that Medicaid program. But now you have to qualify for them. So it's a little bit more restrictive on how they're doing that now. It ends up that we need an agreement with this board. Dr. Stovall will get all the details on that, but I wanted to mention that. But what I also wanted to mention in that is because of those cuts in the emergency room, it's having us go out and looking at our costs and containing our costs. The process now is consolidating services with our sister hospital in Trinity. We currently have our lab, our CFO, which is the Chief Financial Officer, our respiratory manager, and our OR manager, and ER manager, director, that manage both Trinity. And those are efforts to look at the business in a different way and expand those responsibilities and to save dollars. So right now, healthcare is changing. We also think that Medicare's performing times. We think that Medicaid is soon behind that. So I think healthcare in general is going to change for all of us in the state of Texas.
Okay, how about, you want to go into the surgery center?
I can. What I know about that is the construction meeting that we had day before yesterday with Robert Layton and RTR. They're about ready to pour concrete.
They reported today.
Did they? Okay. I was in Tyler today. Of course, I think it's going to look better when it gets concrete on the floor because it still looked like a dirt floor when I was back there the day before yesterday. But all the plumbing's in, concrete now is poured at Dr. Stovall, and at that point, they'll start working in that space, but it won't be long until they start the hallway. It's number one hallway is what we call it, where those offices were going into ICU. So there's going to be a noise factor with the exhaust fans. There's going to be some inconveniences there. We are also told that they're going to redo that hallway's flooring, partition that hallway off going into that ICU, and so it's going to be a more narrow space in there to get patients in and out of it. That's pretty much that on that space.
Okay. So they're pretty much on schedule. Any questions about either item?
Still before the end of the year for completion?
They did mention November. There's no times in November, but that's what they're saying.
Thank you. Quick report on the lease renewal committee.
Lease committee met on February the 15th at Dr. Stovall's office. Myself, Dr. Morrison, and Barbara Krausen were there. The committee made note that there still has not been any response from ETMC regarding the information requested in the letter dated October 25th, 2011. The information requested was a way of beginning looking at our lease renewal process. The committee requested that Dr. Stovall contact Kevin Reed, our attorney, to see what our options were going forward regarding lease negotiations with ETMC. Mr. Reed will be invited to whatever meeting he's available to, hopefully the March meeting or the April meeting, and we'll be here. And then we'll meet with the board, probably meet here in the meeting in open session first, and then go into an executive session after, and then we'll come back and discuss whatever we discussed. Meet again in March before the next meeting. Right now, we've tentatively set up March the 7th as our next committee meeting. So if any of the public wants to give any comments to the committee, they're more than welcome to. That's my report.
We started this contract almost 20 years ago, and this district did. And the prime part of that contract was delivery of healthcare services in Houston County. You and Deborah were both on the board at that time. And as we all know, that initially started out well, but there's a continuing reduction of time. I'm going to just go through a few brief things that were apparent. If you remember in the contract, they were established rural health clinics. They did initially, but the two that were most crucial, both that and Centerville and Grapeland, were both closed shortly after opening. Started out 6 or 7 years ago, they began a reduction in services at the hospital in 2004. They reduced the house supervisory positions and the nursery tech positions for staff. They reduced the maintenance department that year. In 2005, that was the year that both Dr. Stratton was, we lost our orthopedist, which is out in the contract that they have orthopedist to your office living. So Dr. Sicoli left, our cardiologist, later that year. And also in 2005, we released our infection control nurse. In 2008, we released a social worker, thinking that was an important position. They released the patient care